A 4-year-old boy nearly lost his life in the Volta region after 2 ambulance stations refused to transport him from the Ziope Health Center to Ho for medical care. An eyewitness says the ambulance service asked the boy's parent to follow protocols before they could be of help. The boy is said to have been referred to the Volta Region Hospital for further treatment on Saturday, but according to the nurses, all efforts to reach the ambulance service in Ziope proved futile. Let's take you to the Volta region and speak with the Acting Regional Director of Health, Dr. Sena Nukwisi Jokoto. Doc, many thanks for your time. What have you gathered from the incident so far?
Thank you very much. Let me commend the public for this particular interest in this matter, because we all want to see the best for the Volta region. What we have gathered on this particular matter is that a night before the incident, the child had come to one of our facilities here in the Volta region, that is the health center at Ziope. And per assessment, they were referred to the teaching hospital in Ho, which is about 20 minutes drive. The mother was unable to go to the teaching hospital on that night and came the next day, where the child was moderately to severely ill. The nurses on duty made efforts to reach the ambulance service, and that is where the challenge is. They were not able to get through to the ambulance service through the control center. Later, we were to find out that the number that particular nurse had was not the control center's number. So it meant that the information had not gotten to the ambulance service. But in the midst of that delay, the nurse made a quick judgment call that if the child can go to Ho unassisted, then it will be prudent that an alternative vehicular arrangement is made. So the arrangement was made for this child. The child got to the teaching hospital safely. And as I speak now, he's responding to treatment. I'll add that over the period, the country has invested in the ambulance service, and we have made progress. But definitely, we still have some gaps that we have to deal with, we have to fill. Okay. Referral systems are key. So we are hoping that some of these exposures will lead us to further strengthening the referral system in the country.
I'm glad that you say the boy is doing well, but what is the protocol regarding securing an ambulance, especially in emergency situations?
The hospitals are linked to all the ambulances, and knowing that it's only one ambulance operating per district, sometimes they could be engaged. So when you speak to the control center, they will link you to the ambulance. So that is the protocol. You have to get to the control center. The control center would get you the ambulance that is available at that point. And the ambulance will move to that particular point, pick the client, and then send to the hospital that the client has been referred to. So that is the laid down protocol that we work with.
So you said the boy is doing well. Is he in your custody? Is he still in the hospital, or he's been discharged?
He's in the custody of the teaching hospital.
Okay.
And he's responding to treatment.
In terms of percentage-wise, I mean, how well is he?
Well, I'll say that he's doing better than when he reported. We are hoping for a quick recovery for the boy. And we would also want to tell the caregivers that we wish that they would have gotten better service, but we are going to look into it and ensure that subsequently clients will be treated much better.
What was he suffering from? Is it possible to share with us?
That will breach doctor-patient confidentiality, but I can say that he was moderately to severely ill, and he needed attention that could only be offered at a tertiary level or a secondary level. They went to the health center initially. The health center thought that they would receive better care, either in a regional hospital or the teaching hospital. And the closest was the whole teaching hospital, which is about 20 minutes drive from the Ziope Health Center. So that exactly was done.
Let's look at the region generally. Are you shortchanged in emergency services?
I can say that emergency services can have improved over time, but definitely there's still more room for improvement. So we are not at the ideal position yet, just like any part of the country. I don't think that we have reached the ideal levels if we compare us with more developed countries across the world. But we have to strive and continue to work towards excellence. So as a health service, one of our values is to pursue excellence, and we'll continue to pursue excellence working with all stakeholders.
I'm grateful for your time, Dr. Sedanukwesi Jokoto. He's Acting Volta Regional Director of Health Services. Now, staff members...